Hi everyone, Dr. Z here. Today I have a guest speaker who will be telling us about gene therapy. Our speaker is Dr. Kevin Strauss, who is the medical director of the Clinic for Special Children in Strasburg, Pennsylvania. Dr. Strauss, I would like to thank you for your time today. We have some questions for you and would appreciate it if you can share your experience with us.
Thanks, it's great to be here.
So our first question is, we've been hearing a lot about gene therapy lately. Can you tell us a little bit about it?
Sure. So for many of the disorders we treat, the basic problem is that there's an error in a gene and that genetic error leads to a lot of different health consequences. Typically in medicine, what we have been doing for the last several decades is we treat the symptoms of the problem. Maybe those symptoms are seizures or liver disease or heart disease. Gene therapy is an approach to fundamentally correct the problem at its root cause. And so these are what we would call DNA-based therapies. There's a number of different types. In general, they all can be categorized into four big categories. So one of those categories, and the one that's most popular now, is called gene replacement therapy. This is where we take a normal copy of a gene that's damaged and we replace it in the cells of the body that are most susceptible to disease. And the main example of that right now is the work that's being done with spinal muscular atrophy, or SMA, where we replace a gene in nerve cells of the spinal cord, and it helps to preserve those nerve cells and to prevent the consequences of neuronal death. The second type of strategy is gene silencing. So sometimes a gene is damaged in a way that overexpression of a gene or overactivity of a gene is actually what causes the problem. So this is an approach that tries to silence that overactivity of a gene. The third strategy is gene enhancement. So in some cases, there may be a gene that we can switch on to protect from disease consequences. This is the kind of strategy that might be used for something like Alzheimer's disease or ALS. And the fourth strategy is gene editing. Gene editing, many people have heard of CRISPR technology. There are other technologies like CRISPR. This is where we don't replace a gene that's damaged. We actually use technology to go into the body and edit or completely change a person's normal copy of a gene. This has been done successfully in animal experiments and in the laboratory, but has not really been applied to humans yet. But I think we'll see this kind of technology advancing in the next few years. All of these technologies have in common the fact that we are, again, addressing at the root cause of genetic disease, correcting the genetic problem, which hopefully for the patient will correct all of the downstream disease complications.